You know, it's hard to believe that the fight against the coronavirus is in its second year. And in the last year and a half or so, there is something new that the world learns about the virus almost every week, whether it's new variants, new symptoms, or its after effects. One such after effect is putting patients and doctors to a sense of panic across India, and it is the black fungal infection, scientifically called mucormycosis. The rare fungal disease is hitting COVID-19 patients as the healthcare system continues to reel under massive pressure. As of May 19th, at least 7,250 cases of black fungal have been reported in India.
हमारी इस लड़ाई में अभी इन दिनों ब्लैक फंगस की एक और नई चुनौती भी सामने आई है। इससे निपटने के लिए जरूरी सावधानी और व्यवस्था पर ध्यान देना जरूरी है।
Hospitals are now facing a shortage of medicine used to treat the fungal infection. India's health ministry says that it was looking to rope in more companies to produce the antifungal drug. 5 additional manufacturers have been given license to manufacture the drug, and production by existing 5 manufacturers has also been ramped up. India also plans to increase its import of the antifungal drug to fight black fungus. On Thursday, the government asked all states to declare black fungus as an epidemic. The health ministry has asked states to list it under the Epidemic Diseases Act 1897. This means all confirmed or suspected cases have to be reported to the health ministry. All government and private health facilities, medical colleges have been asked to follow guidelines issued for screening, diagnosis, and management of cases. Delhi has set up dedicated treatment centers for black fungus in 3 hospitals. While the news of this symptom has sparked widespread alarm, it is important to understand that it doesn't affect everyone. So let's understand what causes this infection and why it is suddenly being reported in COVID-19 survivors. This rare fungal infection is caused by a group of molds. The black fungus affects the sinuses, the brain, and the lungs. While it's been observed in recovered COVID-19 patients, it's mostly affected and affects immunocompromised patients. For example, those with diseases like diabetes, cancer, and others. According to the US CDC, it is most common in diabetic patients. So what are the symptoms? Well, it ranges from a headache to even nasal congestion. Patients typically have a stuffy and bleeding nose, swelling and pain in the eye, drooping of eyelids, and often loss of vision. If diagnosed late, it even has a mortality rate of around 50%. Prior to the pandemic, the infection was very rare, but the sudden rise can be attributed to multiple factors. One is the use of steroids in COVID-19 patients. The black fungal infection may be triggered by the use of steroids. Exposure to wet surfaces also increases the chance of infection. While the frequency of this fungal infection is on the rise during the second wave, one way to stall it is administering the right dose and duration of steroids. When detected on time, it is often treated with an antifungal intravenous injection. In Indian state of Bihar, 4 cases of white fungus infection have also been reported. This infection is considered even more dangerous than the black fungus. Experts say that the white fungus infects lungs as well as other parts of the body, including skin, stomach, kidney, brain, mouth, and other parts.